Good afternoon, everyone. I'm Jennifer Griswold with KMTV3 News Now, and we are live talking about back to school. It's part of our series called The Rebound Heartland as we address different topics. And today we're talking about how to safely go back to school. It's obviously an issue that people feel very passionately about, as people should. It's our children. So a lot of different opinions out there. Today, we want this to be a discussion. Talking about how decisions are being made, why decisions are being made, and what the experts are thinking as we go through this. So I'm joined by the experts, Dr. Mike Lucas, Superintendent of Westside Schools, wave right there, Dr. Mark Adler, Superintendent of Ralston Schools, and Dr. Tina Scott Morehouse, who is with a pediatrician with Children's Hospital and Medical Center. Thank you all so much for joining us for this discussion. We invite people who are watching and listening to put in your question or comment or what you would like us to know and talk about, and we'll address it during this discussion. So first of all, number one thing I think is we've heard and we've seen that things can change. School hasn't started yet, and we've seen that with both of the districts, Ralston and Westside, that things even have changed. Dr. Lucas, I'll start with you. I think we can see by the fact that it had changed from fully open to now that hybrid model, if you will. It shows that there was the intention, the hope to have all students back at school. Why is that important?
Yes, ma'am. We announced in late June that we were in our green mode, which is all students every day. We did provide a stay-at-home learning model as well. And we feel it's important to get kids back in school, obviously for academic reasons, but social, emotional reasons, being around their peers, being in an environment that enriches them in a lot of different ways. And we can't wait to get back to our green mode. We had to make an adjustment this week as we got within 3 weeks of school starting to what we're calling yellow, which is a hybrid model where kids will come into school 1 or 2 days a week. But there's a lot of reasons for wanting to get them back full time around our great staff in a real structured environment, healthy meals, and a lot of social emotional supports.
Same question to you then, Dr. Adler. Same thing of, I'm guessing it's echoing a lot of the same thoughts there, but why was the hope to have it back with all students?
Jennifer, definitely, I echo a lot of the things, all the things that Dr. Lucas said. We want all of our kids back in school all the time. But it's one of those things where as we get closer, at least when we look at how we can provide a safe and healthy environment for our students and our staff, that we felt like we had to go to our hybrid model, which is our yellow, to try to be able to better social distance. Like I said, we want our kids back as quick as we can, but we also want to make sure that we do that safe and in a healthy manner. And so that's our approach right now, and we're going to keep working hard to do our best to monitor all the things that are happening within our local area and across Nebraska and make decisions accordingly.
We hear from a lot of parents. There are some parents who feel very, very passionately that kids should not be in school. And there are some parents who feel very passionately that kids should be fully in school. There are a lot of parents, however, and I'll admit I'm one of them, who wonders, what is the best choice? What should we be doing? I'm going to ask you, Dr. Scott Morehouse, what should we as parents be thinking about, looking at, assessing for our own families and children when we're making some decisions here?
Exactly. You make a very good point. You have to look at it in regards to your own children and your own family. It is a very, as you pointed out, some people feel very strongly one way, some people feel very strongly another way. And it has to be a very independent decision made on not even just a family level, but a child's level. I have spoken with many families over the course of the last few weeks, and I've got a couple of families that are going to choose to maybe keep one child home and send another child. So it's very family dependent. It's very child dependent. It's a very personal choice.
Dr. Lucas, explain if you will, what will schools look like? You talked about how, one of the big things of going to yellow is to get it so there are fewer kids in the classroom. But what are some of the things we'll see when school opens up of changes made to the classroom, made to drop off, all different procedures?
Yeah, and we've been lucky to work with Dr. Adler and all the Metro superintendents and the Douglas County Health Department, professionals at the Med Center, and everyone else has really helped a lot. You're going to see a lot of dedensifying efforts, coming out of some school safety initiatives over the last 20 years. We were taught on the school side to really funnel everybody in and out of one entrance. Now you're going to see multiple entrance and exit points at West Side because we want to de-densify the number of children and staff that come through entry points so it's easier to social distance. You're going to see plexiglass in a lot of areas. Our eating areas have been expanded. We have staggered seating at our tables. Lunch tables that used to seat 12, 14, 16 kids will now seat 6 to 8, maybe 10. They'll be much more spread apart. Classroom makeup will look differently as far as maybe not a lot of the homey type furniture that you have, especially at the elementary and middle school level with bean bags and smaller tables. A lot of those things are being taken out for right now so we can better social distance.
I see a question was, what will happen if a child cannot keep a mask on or cannot have one on for a full day? Dr. Adler, what are you looking at there? That comes up a lot. People are really not sure how this is going to work. And I think some people are saying, well, what's going to happen if my kid takes their mask off? Are they going to be sent home, punished? How are the schools working with kids that way?
I can tell you how we are, Jennifer. I appreciate the question. Probably I want to lead into this with at every corner, what our goal has been is how can we lean into our students, our families, and our staff to try to meet them at a place where there's a comfort level. But I will tell you from the start, our board has been very particular in the requirement of wearing masks. With that being said, I think we have to work with our kids. At Ralston, it will be a requirement. Honestly, I don't want this to be a disciplinary issue. I want to try to not have it get to that point. We're going to work with our kids. For example, elementary kids, we have at least 20,000 disposable masks for our elementary kids. So if we have an issue where maybe a mask is soiled or falls off, it's on the ground, whatever the case, we're going to get a new one for them. So that's going to be our approach. I can tell you if we get to a point where students refuse to wear masks, I'm probably thinking about older students. For us, it's going to be you have an option to wear a mask and come to school or choose remote learning. That's going to be our approach.
Dr. Scott Morehouse, with that, what do you tell kiddos? I guess kiddos, young kids, and then even older kids. How do you talk to them about wearing a mask, and what do you explain to them about why we're wearing masks?
I personally think that you can approach masks on a child's level, depending on how old that child is. I know you can. I've had families do it. Truthfully, I think you have to explain to them why they're wearing a mask, that it's to keep them safe and it's to keep their friends safe and their teachers safe. And even little kids, kindergartners, pre-K kids understand that. Older kids understand it as well. So I think you have to come at it at their level. I have had a lot of conversations around mask wearing and families, and I just recommend that parents encourage and teach and model in all of their children and all the people in their home. It's very doable. I have to tell you, little kids love their masks. They love their cloth masks that grandma made them or their mom made them. It has Batman on it, or pick a character, Bubble Guppies, whatever. And they're really doing well with them.
Yeah, I think that's important. I mean, I don't think any of us think masks are fun, adults, kids, anyone, but at the same time, for kids, make them fun. I have a 3-year-old and a 5-year-old. My daughter always wants her mask to be a pink one. My son has asked for camo masks. So, I know schools are providing different ones, but at the same time, if you can, if that's something you can do in your household to add to the back to school list, maybe have one that that they'll think is pretty cool to start the school year with. One thing that came up in the question is, there have been questions about, let's address this one first. My 6-year-old has no problem wearing a mask. He understands why and does not have a problem with it. We help make it fun by ordering ones he likes. Totally, Megan. That's what we're talking about here. And I think that does make it a better situation for everybody. So with it, so some kids we've heard maybe can't wear a mask or because of they might be disturbed by wearing one. It might be uncomfortable for them. They might have a special need that you need to address. For children like that, what is going to be the process in determining that? Dr. Lucas or Dr. Adler, whoever wants to take that.
I can get it Mark weigh in. There will be some medical exemptions, some developmental issues that will prohibit some children, regardless of their age, of wearing masks. And so we'll look to make sure that we protect our staff. We're requiring all of our staff and students to wear masks that can. So those with special needs will not wear a mask. We're looking at some shields and different things that maybe they could wear. And we're looking at really social distancing. That's going to be a big part of our plan. We're really stressing, trying to be state champion in the 3 W's: wear a mask, wash your hands, watch your distance. And for our special needs kids who can't wear a mask, we're going to really emphasize watching our distance and washing our hands.
All right, Anne Marie, that was a question you had. What about special needs kids? We did address that there, but let us know if there's anything more specific or anything else you want to know about that. I know I have talked to other physicians about the face shields and screens and things like that. And at this point, it is seen as the masks are the best choice, but that is definitely a good choice as well if that is needed in classrooms. Dr. Scott Mordhaus, do you want to talk about that a little bit about, what the different face covering options are?
Again, as you said, face mask is the best. And face shields are maybe better than nothing, but a face mask is the best. I will say that even my kids with some delays are doing very fine with masks. It is a problem if they can't get their mask off on their own. But I have very few kids where there will be an exception. I do tell families, or I would recommend to families, that if they have concerns about their child wearing a mask or choosing between a mask or a face shield, have that conversation with your pediatrician. Your pediatrician knows your child better than anyone else does. But overall, there are not going to be a lot of exceptions to masks, I don't think.
Yeah, we have heard there will be in most schools. They're trying to work out mask breaks, if you will. Dr. Adler, when are times that people might be able to take it off for a little bit and take a fresh breath?
Something we're really working on. We've talked with our teachers about, can you take a little break, go outside? We even have a couple of our schools that are putting spots, outside on the cement and different things like that, where it's adequately social distance so we can take mass breaks. So this is really important. And I think we've had good luck. I'm very pleased. We've had student registration at our high school this week. People have complied. I just want to say I'm very grateful for that. But we also know this is difficult. And so we're going to try to lean into our students and our families, provide opportunities for mass breaks where we can social distance and do it safely.
Dr. Lucas, can you talk a little bit about what went into the decision to go from green to yellow? Who were you speaking with? What were you assessing? How are these decisions made? Maybe take us behind the scenes a little bit for parents to know.
Yes, ma'am. It's, again, a very difficult decision because we want to be in green for all the services that schools provide. So in June, we had backed up the start of our school to August 18th, just trying to buy time And we have weekly visits with Dr. Adipur, who's been amazing at the Douglas County Health Department. We put together some medical panels of some experts at UNMC, and we have met with them each week. And as we got closer and closer to what we thought was our drop dead date, which was this past Tuesday, 3 weeks before school starts, we were looking at the rate of infectious disease throughout our community. We were looking at the confirmed cases per million, the metrics that really leadership at the Med Center had clued us in on. And we just felt that in order to give our families enough time to prepare, we stayed in green as long as we could. But once we got to this past Tuesday, the 28th, we made the move to yellow because of the rate of infection throughout our community, and it hasn't slowed down like we were certainly hoping it would by this time.
At this point, I was noticing it's not right now. You're looking only till, and I can't remember the date now, but you have kind of a date of when you'll reassess or have another decision by.
Yes, ma'am. We're trying to get to Labor Day, so we're only talking 14 days of school: Tuesday, August 18th to Friday, September 4th. And so we're going to be in, again, what we call our yellow mode. That's fit. Our elementary students will be on campus 2 days a week. Our 7th through 12th grade students will be on campus 1 day a week. Just for those first 14 days, we are hoping that we will be able to do more in-person instruction after Labor Day, but we're just trying to take it 2 and 3 weeks at a time. Because I'll tell you, and I think Dr. Adler would agree, every day feels like a month right now. Things change so rapidly, and the amount of information and the passion, you alluded to it earlier, the passion that comes on both sides of this is overwhelming. And so we're really trying to keep as many people as we can engaged and hopeful about what we can get to in our near future.
We had one comment there. Dr. Adler, thank you for your leadership. So I want to pass that along as well. Definitely. Thank you to all the decision makers in this. I know, I can't imagine how long the hours have been. As you said, it seems like every day is lasting forever. Would we have any option that our children study at home and talk to the teachers through video calls? Would it be possible? I think it would be the safest for our children, for us as parents. So, I mean, I'll give it to Dr. Adler, but I guess I can say we know many schools are doing both options where you're at home a little and you're in person a little. And then most schools are also allowing a remote option. So yeah, if you could address what she was asking, Dr. Adler.
Yes, I would agree with Dr. Lucas. One of my main concerns is the social emotional health of our kids, and so that's been really important to me. As we build our remote learning plan, or we're calling it our extended campus learning plan, for sure in our elementary, middle school, and high school, we're going to have connection with those, with our teachers, with kids every single day. We have a thing, it's part of our social emotional support for kids in our elementary, which is called morning meeting. And we're going to try to incorporate our elementary students into morning meeting every day, so try to keep them engaged. It's really important that we do this. One of the things that I think is important for people to know, in our business, in education, we're in the hope business. And we're going to try to do everything we can to keep our students and our families, their hope up, that we're going to get through this, we're going to be stronger, and hopefully this is in the rearview mirror sometime soon.
I think that hope piece is important. I was going to ask you, Dr. Scott Mordhaus, about, I know you're a pediatrician, not a psychologist, but I'm sure you get parents who are, I'm sure all of you get parents who are concerned that they're going to be doing it wrong, or they can't give enough to their child. How do you comfort parents in understanding that you got to be able to give what you can give, but we're not equipped necessarily to be a teacher, someone who also works and cares for the children? What's your advice for these parents who are overwhelmed?
I have to say, and I've been talking with, again, parents a lot as we get close to school, and the schools overall, my clinic's in Plattsmouth, so I deal with schools in Bellevue and schools in Papillion and schools in Plattsmouth proper. And I've told them, work with your schools. Schools are being so understanding, and parents aren't teachers. And there are some parents that are very comfortable with the rule, but there are others that are not. And there are others that, quite frankly, just can't because of work or other children in the home. So I reassure a lot. I let them know that it's okay to be uncomfortable in this situation and to reach out and use their resources. And the schools have been amazing resources.
And Jenny, I would like to add this. This is going to be my 18th year as a superintendent in the great state of Nebraska, and it's changed a lot in those 18 years as far as what schools provide for children's and communities. And the reason I'm so passionate, and I know, Mark Adler is one of the greatest guys in the country, not just Omaha. And so it's great to be around other educators like Dr. Adler, but the reason we're so passionate about trying to provide as much in-person instruction as we can, getting our kids back into school in a routine, we know what a lot of our kids deal with when they're not at school. And I was one of those kids. I grew up in poverty down in Florida. I lived in a trailer. I lived in a hotel. I lived with friends. I wasn't as worried about math and reading tests sometimes because we weren't sure where we were going to sleep that night or if we were going to eat that night. And there's way too many of our children in West Side, Ralston, and all throughout the metro that have similar circumstances. So I think when a lot of people think of schools, they think of reading, writing, arithmetic, science, all that. And that's always going to be our primary objective. But schools do a lot more than just teach. Teaching is extremely important, but we have kids in our facilities pre-COVID, 7 a.m. to 8, 9, 10 p.m. For lots of different reasons.
I know that came up even when they had to cancel school in the spring. One thing that came up was a lot of times teachers are the ones who report if there are any child abuse or problems in the home. So just not having that extra connection even was a concern. So that would be one of those things where, right, you're an extra set of hearing eyes and ears for kids.
Right. And we're obviously worried about the physical health of children and our staff with COVID and coronavirus, but also mental health. Mental health is of grave concern for us all. And that's why these decisions are so difficult and really gut-wrenching.
Yeah, Dr. Adler, from your experience over the years, I mean, we were talking about how busy the summer has been, but how tough are these decisions you're having to make this year compared to the years you have of experience?
I can tell you one of the things for me that has been, I suppose, difficult is just that internal turmoil for me in, are we doing everything we can to ensure health and safety? And at the end of the day, we can't eliminate all risk, but I think the approach is we're trying to do what we can to make this a safe and healthy environment as possible. But here's the thing: we have great health officials. Dr. Lucas talked about Dr. Poor. We also work with Sarah Schramm, area superintendents. Just a lot of different folks have leaned into this. We've taken a lot of advice from UNMC, but I think at the end of the day, we have to do what's best for our community, our school. Every facility is different. I think that's important to know that we set this blueprint from our offices here in Ralston, but then every one of my principals has a different campus that they have to apply those principles and see how that's going to work. So it's been difficult, but I've been doing this a long time. I love it. We represent our kids and our families, and we're going to keep working hard to do that.
What options are the schools providing for families who do not have childcare for the split week schedules? Anyone want to tackle that one?
I can start, and maybe Mike. For us, it's hard to do that. And I would echo what Mike said. When I grew up, growing up, my dad was a plumber, my mom was a bookkeeper, so we didn't have a lot. And I absolutely knew when we made this decision to go to our yellow hybrid plan, which is every other day, I knew it would be a challenge for parents. But when I think about the importance of safety in our school, that had to win the day. And so I know our parents are having difficulties. It's hard for us to provide extra. If we could, we would. But it's counterintuitive in the fact that we're trying to reduce the population in our building. If we would then take in, the students that are in the group that's home for that one day, it would be difficult. So I guess what I want to say is I recognize it's a challenge. I knew that from the start, but safety still has to win the day with me.
Yeah. That's a great point, Dr. Adler, and that's the same over at Westside. That's why we felt so much urgency to make our announcement this past Tuesday, which was 3 weeks before school starts, to give our families time to plan. And to be honest with you, we've told people from over here since June that yellow was our least favorite option. Yellow was the one option we did not want to go to, but as our community infectious rate continued to climb, we realized that yellow was going to be our only option to see our children in a safe manner. So we have a great Westside Foundation. They run some before and after school programming, and I know they're looking into some modified child care resources during the day. But again, like Dr. Adler and Ralston, we're trying to limit the number of bodies we have on each campus.
With that, what are the things you're looking at in terms of whether or not to go to red? Obviously, it'll be the call that you guys are making, and parents have to wait for that. I don't want them to be taking notes and saying, "Oh, we're going red now." I'm just asking, what are the types of things you're looking at?
I think at Westside, we're going to be looking at again, and we're trying to, like any other school year, we're going to be better on the third day of school than we are the first day of school. We're always going to live and learn and make adjustments, but we'll be looking closely to rely on our local medical experts, of which we're so lucky to have so many in Omaha. And what is our confirmed cases per million doing? What's the rolling 7-day average? The things that we've been trained and taught by Dr. Poor and others to look for are the metrics that we want to use. And it's going to be a lot of expertise provided by the medical profession to let us know if we can continue to stay in yellow, if we can actually upgrade to green, or if we would have to make that brutal decision to go back to at-home learning. But it'll really come down to our medical experts and what they told us: confirmed cases per million, rolling 7-day average, and I think we rely on them again.
We've heard, oh, here we go, another one. Any plans for teachers who might not have childcare due to yellow status school schedules? Dr. Adler or Dr. Lucas, you're kind of pointing. Do you want
to? I can take that one.
Sure.
So one of the biggest challenges we have, Jennifer, is the teacher workforce. We have fewer and fewer teachers going into the workforce, and on a normal year, having substitute teachers is a challenge. It has been for probably 4 or 5 years. We are going to offer some daycare for our school staff on the days that their kids are not in school. And we're doing that because we need them to be at work. And if they had to be at home with their kids, that was going to be a challenge. So it's something that we've wrapped our arms around. It's about a workforce issue. And it's also about, organizations, I think, are stronger when we do what we can to support our staff. And so we are going to do that here in Ralston.
So yeah, it sounds like that is then something that would be pretty specific to your school district. So get in touch with your district and see what options might be available.
Right.
We have a new question just joining. Has anyone addressed the NSEA letter? I believe they're then talking about the letter of the union talking about how it's not safe for teachers. First, to set the table, if Dr. Scott Mordhaus, if you would talk a little bit about, we hear a lot different arguments. Some say, well, children can't get this much, and some say no, but they can spread it to others. What are we looking at with the virus in terms of kids and adults in a school setting?
There is a lot of information out there that suggests that kids may be asymptomatic spreaders. They may have virus but not get sick and be able to spread it to adults. There's nothing really solid out there. We know that kids under 10 tend to be less symptomatic than kids over 10. But truthfully, if we approach this academic year with, and I loved it, the 3 W's, wear your mask, social distance. If we do all the things that we're supposed to do, we're going to minimize risk. And that's what we have to do.
I think we lost Jennifer for a second.
I did like the 3 W's, I have to say.
Mark, I'm going to take this opportunity to compliment you on your hair today. I think it looks especially great.
Well, thank you, Mike. I was going to say, leave it to Dr. Lucas to come up with the state championship of the 3 W's. So
we're going to try.
I love it. And I'm probably going to copy that. So
hey, you can be Class B state champions.
Yeah, Class B, West Side's Class A. We're going to be the state champs in Class B on the 3 W's. So
my kids are West Side kids, so we know where I land.
All right.
Love the 3 W's. I actually somehow pressed a button and got myself clicked out of the conversation for a second there. So I'm not great with this technology these days. So does anyone else, the viewer who asked about the NSEA letter said just joining. So I don't know if it's also talking a little bit about what you were talking about at the top of everything you're considering. But would Dr. Lucas or Adler like to talk a little bit about why you're making the decisions you are in terms of the hybrid model?
I do want to address that really quick if I can. We have an excellent relationship with our Ralston Education Association. And I will tell you, the leader of that group, I talk to almost every day. We work together. And just like we're really trying to work with our families, we're trying to do the same thing with our staff. We're working with several staff in how they can, they have concerns about returning to work. We work through a process where we can access their exceptional skills and help us do some stuff from home. So I would say our approach has been, and I think it's true across the metro area and probably Nebraska, how can we lean into the people we need to do the best we can, provide a comfort level for them. And so that's what we're doing. And so we have a great relationship with our association. We're aware that folks are, have anxiety about returning. So do I. But in the end, we're going to do everything we can to keep healthy and safe in our environments.
Yeah, same over at Westside. We have a great relationship with our WEA. We just actually got out of a meeting with them. So we've been in constant communication with them, and our school board deserves a ton of credit for really creating a culture and an atmosphere that supports all students and staff. And we appreciate our teacher leaders working with us and trying to meet the needs of our students.
On a lighter note, as we head to winter, are snow or cold days still a possibility, or will they now be online learning days? That is interesting as we're equipping people to be able to learn at home. What is the thought on that, or have you not gone that far yet?
Mark, I don't know about you, but I'll never complain about a snow day decision again. That seems so minor now. What do you think, buddy?
That's what I was going to say, Jennifer. I was going to say Mike and I would give anything to make a snow day decision right now.
I was thinking last night, it was 3 years ago, we were getting ready for the solar eclipse on August 21st of 17, and there was a lot of angst about students' eyes getting injured and all that. And boy, that was a big deal. I would do anything to go back to that right now.
Jennifer, I gotta lighten up a little bit here, but my business manager said maybe we should take all the solar eclipse glasses and sell those that we bought for kids, and then we can buy more masks. So
Yeah.
There you go. Yeah, you gotta get creative with it for sure. With that though, like, are there going to be, for other reasons, potentially remote learning days? I mean, is that something that could happen?
I think it is. I'll tell you, Beth Morissette, one of our great board members, came up with a great term that we have absolutely worn out the last couple of months: forced innovation. A forced innovation of COVID. What are the things that COVID has forced us to do that we're maybe going to carry forward with us? Well, I think a lot of it could be online learning days and the way that we do instruction when students miss school in the future for a dentist appointment or to go visit grandma and those types of things. So I think learning has changed for the better coming forward out of this pandemic.
I would add to that, Jennifer. I think I agree with Mike, but we've learned some things and we've went places during this challenge that I don't know that we knew were possible. So I think we are going to leave this pandemic hopefully soon better and stronger and knowing more. And so there are good things to this, and I think that's one of them. You know, one other thing really quick, I think it's also allowed people to understand the multiple things schools do for students and families. You know, when on March 12th was our last day of school and we sent the kids home and they don't even know that now they're going to be out of school for an entire quarter, teachers the same way. And then suddenly parents or teachers, and we're trying to figure out, you know, we serve over 6,000 meals a day or a week in the summer to students and families. And so there's a lot of things we do that I think people are maybe recognizing there's a lot of value that schools provide, and not just in Ralston, but all across Nebraska and definitely West Side and across the metro area.
Laura asking, is there anything in place as far as a protocol for what will happen when there are positive cases? Dr. Lucas, you want to start on that one?
You bet. Yeah, that's where Dr. Poore and her staff at Douglas County Health have been amazing. And so you have contact tracing protocols that you're going to follow. That's another change I think you're going to see in many schools. As a former third grade teacher myself, you used to sit students in groups of 4 so they could cooperatively learn with each other. Now you're going to go back to sitting in rows, spread out, and by requiring masks, you're going to be able to follow that contact tracing protocol. If Johnny was in 3rd grade and he has a confirmed case, you're going to go back to the seating chart. Who was he sitting next to? Were there any situations where he was closer than 6 feet for more than 10 minutes without wearing a mask? That's who's going to need to quarantine. But that's all really laid out very well by the Douglas County Health Department. And we are thankful on the K-12 school side to be able to follow their lead.
You know, with this, obviously, it's not like flu and other things are going to go away. So Dr. Scott Morthouse, you know, if as a parent, my kid has a sniffle that's a little more than I think is allergies or that type of thing, what types of things should we be looking out for? And when should we say, I have to keep my kid home?
Well, honestly, there are resources available, and there are resources available for from Children's Hospital even. They're building a webpage that is available to parents and educators so that they can look at those types of questions and address those types of concerns they may have. You know, parents should be checking, do some sort of a symptom checker, or take a temperature or prior to kids going to school every day. Until whenever. So there are things that may come up when you're asking your child, or your child reports a sore throat, or you notice a fever, or there is a cough. I think it's fair to call the pediatrician or your family physician and discuss the symptoms with them. Obviously, if there is a fever, it's really important to keep that child home, regardless of what you are afraid it may be or what it may actually be. But there are definitely situations where you're going to want to reach out to your doctor or your child's pediatrician and ask that question. In regards to, kind of symptom checking prior to school entry, Dr. Rusty McCullough at Children's Hospital has built an app that's going to soon be available for parents to run symptoms through, because it is, we don't get a pass on the rest of the viruses that we're going to see through viral season. So, it's okay to use your physician, use your pediatrician, and use your best judgment. Obviously, fever, stay home.
Dr. Lucas, you were talking before about making sure kids were, or maybe it was Dr. Adler, you were talking before about making sure teachers have the support through all of this too, if they're also parents, and mentioning substitute teachers and things. We've heard from other towns, other cities, other TV station markets, that there has been a bit of a shortage or trouble finding substitute teachers. Has that been a concern you're seeing here, or are you seeing some teachers saying, I can't do it this year? How's that working for the workforce that way?
Jennifer, you're exactly right. We've had a sub shortage for a while. It's something that I think all metro schools are really working hard on. But some of our best subs, believe it or not, are some of our retired teachers that, after a certain amount of time, they want to stay involved. They want to, fuel that passion to be around kids and peers. But some of those folks are older and they're in some of the risk categories. And we've had several that have just said, we, as much as we love being there, we just can't do it this year. And so when you take some of those great subs out, we are definitely working on a lot of things behind the scenes and how we can prop ourselves up if needed along the way. So it's a concern. It's a big concern for sure.
Same for you, Dr.
Yeah, same at Westside, and it's been an issue pre-COVID for sure. I've lived and worked in West Point, Nebraska, Franklin, Nebraska, York, Nebraska, and since 2003, and we've had sub issues since before COVID, and certainly COVID is not helping that situation. So we have an all hands on deck mentality where even yours truly may be teaching some classes and covering some classes here the first couple of weeks as we try and get off to a good start.
What questions are you getting from parents that I've missed? What are you hearing? What are the concerns? Dr. Adler?
So some of the concerns, I think, Jennifer, some of the things you've already brought up are, what do we do with our students on, for us, our yellow plan or our hybrid plan has students going every other day. So it looks a little different than the other schools in a hybrid plan. So helping parents work through that. But quite honestly, recently, what we've been dealing with is just a lot of logistical stuff, understanding, for example, in our high school, we have a block schedule. And so if students are going every other day and then navigating that block schedule along with that every other day could be confusing. And then just different things like what does entry to the building look like? And I know Dr. Lucas talked about that. We're working on plans for that. Staggered dismissal so we don't have groups of kids sitting in one place at a time. What does riding the bus look like? When we de-densify our campus, that also makes our bus routes have less kids on there. So all of this for us makes sense. But parents just have it's logistical, what about this, what about that type of questions. And I tell you, our staff has been awesome. We're committed to answering every single email and every single question we get. That includes me, our communications team, our principals. We're doing the best we can to lean into our folks.
Over at Westside, we're getting those same questions. We're getting questions about what will online learning look like this fall compared to last spring? And that's something I'm very proud of our teachers and our teaching and learning team. And our messaging is, and what's going to happen, there will be a lot more direct instruction, peer interaction, and live teaching and learning going on this August and September compared to last spring. So the online option, the extended campus option, is going to be much more robust and much more effective than it was in March and April.
Yeah, definitely families have some anxiety, but they are also very anxious to get back to school and get their kids in school. I'm surprised by how little anxiety there is by the kids to get back into school. They are really looking forward to it. And, usually I get to this time and I'm doing school physicals and I've got, I always ask, are you ready to go back to school? And a lot of times I get, no, no, no. And now kids are really anxious to get back, not just even see their friends, see their teachers. Yeah. They want to get back and see their teachers. They left in March without an opportunity to end that year. So I think there's a lot of anxiety around it, but remarkably, children particularly, are wonderfully resilient and hopeful and very optimistic. And everybody knows we take this one day at a time. And there is some itchy, scratchy stuff that goes around with this right now. But the kids really want to be back with their people. And they're probably sick of their parents.
And I know for mine with the young kids, part of it is too the schedule. They just do better with the schedule, and it's hard when you're in the house to keep it up in the way a school can. So I think there's a piece of that there too. What if students can't do some of the live lessons because of family work schedules? Candace asked. I was wondering that too. So if there's a live option, will there also then be, you could go back and check it out recorded, Dr. Lucas?
Yes, that's our hope and our intent. We plan to be able to video and archive as many of those as possible. But like always, if that, that's won't be 100% of the time. So if there is a just like you did 2 years ago before we ever heard of coronavirus, if there has to be a one-on-one situation to get caught up or a small group interaction to get caught up, that'll always take place as well. But we do plan on having archive videos so families can go back and look at that when it's more convenient for them and keep that as a resource.
Michaela had written, proud to be a Westside parent and teacher. No one can be prepared for this. And they have done a great job of communicating, putting our students and staff first. Thank you. No, I do think that is important. I think, as we said, there are a lot of passionate people out there with different opinions, but I don't think, if you're really thinking about it, I don't think anyone thinks you guys have easy choices here. It seems like between a rock and a hard place, and obviously it's a situation no one has wanted or asked for that we find ourselves in right now. So I do think the way we can all work together is the best option. I think we'll probably wrap it up unless one more comes in. I'd invite you, if you wanted, to kind of do a closing remark, if you would, which similar maybe to what you started talking about, of just what are you thinking about going forward? What is, in your opinion, the best thing for children right now?
I can say one thing that's been on a lot is no matter what instructional level we're in, whether that's green, yellow, or red, I want to try to fuel passion, purpose, and hope for our kids. Every kid comes to school with something they love, or at least that's what I hope. Most kids do, and that's their passion. And I hope that also fuels their purpose for coming here and the things that they want to take away from school. But quite honestly, just like I said before, we're in the hope business, and whatever we do, whatever level we're in, it's going to be our goal to have our kids looking forward, our parents looking forward, our families looking forward, that they have hope for a better tomorrow. And so that's going to be the goal for us.
And the same at Westside, and we have so much respect for Ralston and OPS and Millard and all of our Metro peers. We want our students to know that we love them and miss them, and we want our families to know that we don't take the decisions that we're being forced to make lightly. We know the yellow model is the least family friendly. Um, we know that we have staff and some students and families that have anxiety about returning, but we love our students. We're committed to our students and our families and our staff, and we're just going to take it 2 and 3 weeks at a time. We're going to go from August 18th and try and get to Labor Day, and we really need our community to help us get the spread under control. And I feel like schools, we're really, to be honest, we're really we're being vilified and crucified quite a bit by the decisions we're having to make when we don't get to control a lot of the factors that go into those decisions. So.
Yeah, I would agree, and I think that as a community, we need our kids in school. School provides so many things to children, from food to mental health and emotional health services and well-being, and even activity. This whole thing has really limited kids' ability to get out and be active, and they need to be active. But as people move forward, as these gentlemen have said, they're using their medical resources. Families can use their medical resources as well. Reach out to their pediatrician, reach out to their family medicine doc. Children's Hospital is an amazing resource, and if someone just gets on Children's website, there's they're building all kinds of resources for families and educators. So yeah, I just have to agree, and we have to take it one day, 1 week at a time, and be a little fluid with this. We've never done this before.
I know I said we were wrapping, but we did have a few more questions come in, so we can go through them quickly, see what we can get at. What will sports look like was a question.
Yeah, that's one, and I'll say activities. We like to say activities, not sports, because our fine arts and so many other things are so important to us. And activities are extremely vital to our students, to our school and community. Right now, practices for the fall are scheduled to start August 10th. That could certainly change. I know that there is being kicked around at different levels the possibility of a 2 or 3 week postponement. But I think in the next week we'll hear something, whether it's affirmation for an August 10 start or a delay. But we want to do everything we can to keep activities on the table as long as we can stay in yellow or green. I think if we go to red, activities are gone. And so that's why we're working so hard to try and postpone, delay. We don't want to use the C word of cancel, because once you cancel, you lose a lot of people's hope and engagement. And those activities are important, whether it's cheerleading or dance team or volleyball or whatever it is. That gives a lot of our students a real sense of belonging, a real connection to their classmates and to their community.
Dr. Adler, this was specifically to you. If kids are doing the remote learning, can they still participate in sports? I know some districts have said if you're doing the full remote learning option, you cannot take part in sports or activities.
Yes, Jennifer, we are going to allow our folks who choose remote learning to participate in our activities. So I would agree with Dr. Lucas. When I talked about passion and purpose, that's a prime example. Your passion and purpose might be math, but it also might be tennis or cross country. So we're going to allow that. I know not everybody is. I just feel like we're trying to do what we can to lean into folks. So we're going to still allow that to happen with our activities.
All right. I want to thank all of you for taking part in this discussion. I know all of you have been making yourselves available in various ways to reach out to community members. And so I really appreciate that. As we've been talking, it's tough decisions are being made, and we know that you all have the best interest of children in mind. So thank you for that. As a parent and community member, I really appreciate that. So thank you so much, and thank you for taking part in this discussion.
Very
Thank
nice.
you. Take care, everybody.